Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Vomiting blood is one of the symptoms that will rush anyone to the hospital. Have you ever vomited blood? It may be from small streaks to huge amounts of blood that could fill up buckets. Blood is one of the most distressing symptoms someone can experience. It is okay to bleed from an exterior wound, but it is more frightening if you vomit out blood. It means you're bleeding from the inside. So with me in the studio is a gastroenterologist by the name Dr. Betty Apicha, who will tell us more about this symptom of vomiting blood, why it occurs, and what are the common causes of this very, very distressing symptom of vomiting blood. So welcome, Dr. Betty, to the show. You're most welcome to the show.
Thank you very much.
And I am your host again for the evening, Dr. Darius Sawachi. And we're going to dive into business to understanding more about this very dreadful symptom. So, Dr. Betty, blood, blood is a very distressing sign. Anyone who sees blood gets terribly scared or frightened. It is more distressing if if the blood is coming from the inside, as someone vomits blood, or in medicine what they call hematemesis. We want to understand what could be the cause of this very, very distressing illness.
Thank you, Darius. The commonest cause of vomiting of blood is peptic ulcers, bleeding ulcers.
Okay.
Yes. Followed by enlarged vessels. If someone has enlarged vessels in the esophagus or in the stomach, these vessels can rupture and then bleed.
And bleed.
Yes.
Ulcers are the most common cause of?
They're actually the most common cause of vomiting blood.
Okay.
Or sometimes someone may vomit blood, maybe fresh blood, frank, red, bright blood, or it may be clots. Or sometimes because they've vomited and the blood has sat in the stomach for some time, it gets semi-digested and they vomit coffee brown substance. It's still blood, although it's half-digested blood. If the bleeding is much, this blood can also come in stool. And if the bleeding is not so much, they may just get black stool, or they may get symptoms of anemia, of low blood levels, without necessarily seeing blood in the vomiters or in stool.
Okay, so it basically means...
So it depends on the speed with which someone bleeds and also the site of the bleeding.
Okay, so like you explained, commonly it's by the ulcers. But then you talked about big vessels, what they call varices, which is also another very important cause of the bleeding, of vomiting blood. So what could result in these blood vessels being enlarged?
So these blood vessels could be enlarged in people with chronic liver diseases. If someone has extensive scarring in the liver, what we medically call cirrhosis.
Okay.
This can cause, because the blood vessels from many areas of the digestive system actually join up and pass through the liver before they go to the rest of the body.
Okay.
If for some reason there is restriction or blockage within the liver, because a liver with scars is tough, it doesn't easily allow the blood to flow through. So there is relative blockage, and so there is flooding behind. That is essentially what happens.
Back pressure.
Yes, yes. So because of that flooding within the blood vessels that are supposed to drain through the liver, the vessels swell up. And also because the blood is trying to look for new routes to reach where it's supposed to go, so it opens up what I'll refer to as tributaries. These are the varices.
They're like additional
ways,
alternative
yes,
routes
alternative routes
to
where
escape the
yes, to
blockage.
escape the blockage.
So those are
So if
the
these,
bleeding sources.
yes, if the vessels, the enlarged vessels happen to be in the esophagus, they could easily rupture because they're within the lumen, within the space of the esophagus.
Okay.
Yes, if the pressure within them becomes so high, they can rupture, and then someone vomits blood.
Okay, so it's a very distressing symptom, like we say. Just the sight of blood and someone vomits,
Yes,
they can vomit large amounts
yes.
of blood.
It's
So
not only scary, but it's also life-threatening.
it can be life-threatening. Someone can die
yes.
because of vomiting blood. Okay, so you explain the chronic liver diseases, the irreversible liver damages.
Scarring of the liver, yes.
What could be some of the causes of that?
So some of the causes are chronic hepatitis B infection in our environment, alcohol use, or a combination of them. We also have
of alcohol
with hepatitis B, yes. It's very common to find people with both, since both are highly prevalent in our environment. There is a high prevalence of hepatitis B, but we also have a lot of people drinking heavily in Uganda. So it's not uncommon to find someone with chronic hepatitis B also drinking heavily. But by and large, those are the two commonest causes.
So the infections as hepatitis B, and too much drinking.
And too much drinking. Of course, there are others like hepatitis C and some other rare conditions.
Some other rare conditions. Yes. There are also reports that being too fat might cause liver damage. Yes. How does that happen?
So fat is not supposed to be in the liver, not deposited as fat. It's supposed to pass in the liver as small particles of nutrients called fatty acids, and which can be used in a usable form. But if fat itself deposits within the liver cells, it actually causes inflammation, injury to the liver cells. And injury over a long period of time heals with scars. And eventually you still end up with extensive scarring, termed as cirrhosis.
And then it can result in the end products.
And it can eventually cause this constriction that doesn't allow blood to go through, and so you can still have this flooding, which we refer to as portal hypertension.
So an issue as weight. It's interesting how weight has so many links to very many conditions.
Different things.
It causes heart disease, it causes diabetes, it causes all sorts of problems. And now cancers. It is resulting in liver disease problems, and bleeding from the stomach. But there's a very big important cause, which will be the center of the discussion today, which you're very familiar with. We see lots of people, fairly young people, who are coming to hospital and they're vomiting blood. This condition is known as Bilharzia. What exactly is Bilharzia, Dr. Picha?
So Bilharzia is medically called schistosomiasis. It is a parasite that affects people. So what happens is it actually eventually will go into the details of how it does that, but it can also cause scarring around this big vessel that goes to the liver. It doesn't affect the liver, but it affects the vessel just at the point when it goes into the liver. Okay. So it causes a lot of scarring around this vessel and also leads to flooding, portal hypertension.
Okay.
And after that, the mechanism is about the same, of vomiting blood.
Okay. So Bilharzia, or what they call the schistosomiasis, is, you'll be surprised, but it is a worm infection. And this is not the worm that you get from eating meat or eating pork or eating some other sorts of other foods. This worm loves to live in water. So we are going to understand more about this Bilharzia illness. Why is it such a big issue in Uganda? Because I think it might be the most common cause of people who come with vomiting blood. Okay, so it is a very
in some areas it's
the commonest. Yeah, so it's one of the common causes of vomiting blood. So I want to understand more about bilharzia. So just after the break, we'll come back to understand more about what bilharzia is, how it can be got. Are there certain factors that predispose someone to getting bilharzia? So send in your questions and comments on our social media platforms. That's on Facebook, on Twitter, the Doctalk Show. You can also subscribe to our YouTube page. That is the title, the Doctalk Show, and watch some of these videos that will be uploaded on the internet. We're always happy to hear from you. We want to answer your questions, so don't feel shy to send in your comments or questions on our social media platforms.
You are watching the Doctalk Show.